Welcome to a new episode in our series Orthomolecular Medicine. Today with our guest, Dr. Andrew Saul from Brockport in New York State. Dr. Andrew Saul is one of the most famous, if not the most famous expert in the combination of nutrition and orthomolecular medicine. And if you don't know him yet, I add the computer to show you where you can find a little bit of information about Dr. Andrew Saul, because we don't want to talk about too much about his biography today. Here on our channel, Kosmologie Mikronährstoffe, there is a playlist, Dr. Andrew Saul. If you click there, then you find a timeline of vitamin medicine. And if you go to the third video, which is this one, there I put up a video about the work of Andrew Saul. I can push this away now. So that's about that. So I go back to the interview and cancel this one. Okay, how do I get rid of that? I don't know. Okay, Dr. Andrew Saul, welcome to our series. And I have to do a disclaimer. First, Dr. Saul has the right to do whatever he likes with the footage of this interview, like editing, cutting, using parts of it in any other context, whereas I only have the right to publish this interview unedited and uncut in full length without any commercial interest. Is that okay with you?
Yes, it is.
Very good. So beforehand, we were talking about what we should discuss today. And for that, I use the computer again. And if you Google the words "a timeline of vitamin medicine," you can get here. And let me see how to get rid of this one. Oh, I have to, okay. Now you are. Now you are here. Okay, if you Google the words "a timeline of vitamin medicine," you will get to the Riordan Clinic, and if you go down here, there you find the original source, which is Dr. Andrew Saul, who is the editor of the orthomolecular.org homepage. And if you go to the resources and news releases, you find this article. And it's now 85 years that Klaus Washington Youngblood, professor of bacteriology at Columbia University, first published something on vitamin C. Now, if we go back in history, Dr. Saul, what's your opinion? Why is it that the research and the studies, now 85 years of work by many people, is still not accepted by most physicians?
It's a very difficult question to answer, and there are many different views on this. For whatever reason, we are in a situation now where a whole body of knowledge is being ignored. I don't really think it's a conspiracy theory. I think it's just a human characteristic, which is ego and ignorance and power. And it's a very bad combination. So those that have the power to tell the public to use vitamin C to prevent and treat COVID are not doing that. Maybe their egos are in the way. Maybe they are ignorant. I don't think they're evil. I think they're either consumed with the position that they're in and the influence and the power and the thrill that it gives them to be in charge, coupled with a simple lack of interest in something that they don't have the time for, coupled with an ignorance as to why they should. So for whatever reason, Klaus Washington Youngblood's research on vitamin C, which was published, he did a series of papers, 1935, 36, 37, 38, specifically on vitamin C and polio, and also diphtheria and other illnesses which were particularly a problem at that time. Remember that in the 1930s, the United States had a president who had been a victim of polio and was partially paralyzed because of it. And this is before there were vaccinations for many common diseases. Youngblood, a bacteriologist and a full professor at Columbia University, was showing the way. He was showing that vitamin C could actually help prevent and reverse these very serious conditions. You have to keep in mind that this is 1935. This is a very long time ago. And Youngblood kept on publishing. In 1939, he was featured in Time magazine, where he was commenting on the polio epidemic in Australia and showed that vitamin C deficiency had a lot to do with that. Now, many years later, in the 60s and 70s, Dr. Archie Kalakaranos, a Greek physician living in Australia, was working for the Australian government, and he would go and give vaccinations, particularly to Aboriginal children. And he had a mortality rate of 50%. His vaccinations, he found from his own experience, and he was right there, were killing half of the babies and little children that he gave the shot to. Dr. Kalakaranos wrote a book called Every Second Child, and that's what it's about. Well, he found that if he gave them a modest amount of vitamin C, they did not die. Dr. Youngblood found that if he gave monkeys a modest amount of vitamin C, they did not get polio. Years later, there was Dr. Frederick Robert Klenner of Reidsville, North Carolina, USA. He was a board-certified chest physician, graduate of the Duke University School of Medicine. And Dr. Klenner used vitamin C in very high doses, unlike Youngblood, who used low doses. And you found with Klenner, when he announced this to the American Medical Association at one of their meetings, he had treated several dozen cases of polio with no paralysis. And he'd done that with high doses of vitamin C. So Klenner was reversing polio with vitamin C, presented it to a medical meeting, and did not get any questions. They just went on to the next speaker. Klenner also published in medical journals. He published about 20 papers. Youngblood published probably closer to 30, most of which are still available online at the Journal of Experimental Biology. So this information has always been there. Klenner's work was published. Youngblood's work was published, and yet it has been ignored. Now, people that are in power politically should know this, and people that are in power medically really should know this. And the World Health Organization and the CDC have a duty to know this. And the fact that they actually have come out and said that vitamin C is of no value without checking to see that it is in my opinion, criminal. I don't have another word that I can use, because you have an obligation as an elected official. You have a sworn oath to help the public. As a physician, you take the Hippocratic Oath. You have a sworn oath to do everything you can for the good of your patient to the best of your ability. This is not being done. So I charge all physicians in power and all politicians in power with criminal negligence. They should know better. Indeed, there's a concept in law that you should have known something. And we can apply that to the people that are telling us now, literally, at the World Health Organization and CDC websites, that vitamin C is not useful for preventing and treating COVID-19. On the other hand, we have physicians in China, for instance, Doctors Peng and Dr. Mao, Enkun Mao and Huaqiong Peng, who are in Wuhan and Shanghai, using high-dose vitamin C for COVID patients that are in intensive care. Now, Peng and Mao are both heads of their emergency service at large hospitals. This information has not gotten out to the public except through the Orthomolecular Medicine News Service, which I am pleased that you can access anytime you want to. But we send the Orthomolecular Medical News Service to the media, and we've been doing that for 16 years. They know us. They are ignoring these reports. They are even calling them false. USA Today and Facebook and other major purveyors of information have actually said that it's false news. I have firsthand reports from physicians in China who are saving patients' lives with vitamin C. And that information is being denied to the public. And if it gets out somehow, it is being decried as fake news or false information. None of the media have taken the time to actually check with these physicians. This, to me, is a really big problem. So we have to do the work instead. And this means somehow through videos like yours, this one here and your other videos, we're getting the word out that there is a whole body of knowledge that is being ignored. And it really is. We have doctors curing patients with vitamin C. It is not a matter of speculation. We don't need more research. We don't need clinical studies because we already have them. We don't need double-blind placebo-controlled studies because we already have reliable reports from doctors. Many people think that if you don't have a double-blind placebo-controlled study, something is invalid. Well, our whole life is lived without doing any double-blind studies at all. We live our entire life choosing our friends, choosing our spouse, going through our job selection, where we will go to university. All of these things are done without any placebo control, and none of them are double-blind. I have a science background. I have several degrees in science. I have several teaching certificates in New York State to teach science, and I have taught science at practically every grade there is. The one thing you get across, whether it's to little children, teenagers, or postdocs, is that the number one thing in science is observation. You have to teach people to observe. That's what science is. Wasn't it Dr. Albert Szent-Györgyi, the Nobel Prize winner, who got that prize for his work with vitamin C, who said, doesn't genius consist of seeing what everyone else has seen, but thinking what no one else has thought, or something along that line? We have information that is not being looked at. And before people pontificate that vitamin C is of no value, the first thing they better do is check and see if it is. Now, Dr. Abram Hoffer, the well-known Canadian psychiatrist and the leader of orthomolecular medicine, the one who got Linus Pauling interested in it. Pauling actually read Dr. Hoffer's book one night, stayed up all night, and the next day decided he wasn't going to retire after all. He was going to go into vitamins. So Abram Hoffer, a colleague of Linus Pauling, was my personal mentor. And Abram taught me quite a long time ago the white crow argument. He said, this is how you look at therapies for patients. If someone tells you that vitamins cannot cure disease, that's like saying all crows are black. All you have to do is find one white crow, and the argument is no good.
Let's take one of those white crows. Could you tell our viewers the story of Alan Smith, which is quite comparable to COVID-19?
You're going to have to refresh my memory on Alan Smith.
Alan Smith was this New Zealand farmer who had...
Alan Smith. Thank you.
Smith. We
both speak the same language.
Could you tell the story about Alan Smith and being a white crow?
Yeah, it's all over the internet, and it's easy to do a Google search and learn about this. New Zealand's 60 Minutes news program actually had that on the air. This is not a trivial matter. This made national news. All right, New Zealand's not the biggest country in the world, but the fact is the news media did pick up on this. So here's a man who was given up to die from viral illness, and the short answer is his family pushed real hard to get vitamin C for him, and after considerable effort managed to do so. The hospital was going to literally pull the plug on him and let him die. Well, the family got in there and kept him from dying by making sure he had vitamin C. And when the hospital tried to remove the vitamin C, they gave him vitamin C orally. The bottom line is the man lived, he walked out the front door, and he's been interviewed since. This man was given up to die. Now, this is the kind of thing we cannot allow. The bottom line with COVID-19 is not the virus. It's a coronavirus. SARS was a coronavirus. The common cold is a coronavirus. Coronaviruses are going to be with us forever, and they probably always have been. Viruses are indestructible. You think that you can keep yourself away from a virus, you're living in a fool's paradise. They're everywhere. I used to teach my students that there's enough microorganisms in your mouth right now to wipe out the nation if they had a chance to reproduce and if you were susceptible. So susceptibility is the issue, not whether or not there's a virus. There always have been and always will be. COVID-19 is a nasty virus. It's not the worst, but it's not the best. It's a very serious illness. Vitamin C strengthens the immune system against all forms of microbes, including viruses. And it also has a virucidal effect. It actually seems to destroy viruses if you use very high doses. So the situation here for someone in intensive care who's dying, if you give them vitamin C, they don't die. And this is the key. This is what Enkun Mao and Huang Peng have found with vitamin C with COVID patients, that if they have vitamin C, they don't die. Indeed, Mao reported that he had no fatalities in a series of 50 patients that he treated. This should be on the news. I tried to put it there. It's been branded as false news, as fake news, as false information. So what do we do with this situation? What we do is what we're doing now. You're watching me, I'm talking to you, we tell our friends, and we don't let this go. We have a duty, we have a moral obligation to save lives first. And the only way we're going to do that is to question authority. That was my favorite hippie button back in the 60s, and I still like it. We have to question authority. As Bertrand Russell said, never go along with authorities per se, because contrary authorities can always be found. And then it was Linus Pauling who said, when a scientist of distinction with gray hair and degrees talks to you, listen respectfully, but don't believe him. Look into it for yourself and make up your own mind. One of the most insidious things about locking down people is that we're stopping them from making up their own minds. We keep them from socializing. We keep them from their jobs. We keep children from school. We keep children away from their friends. We instill people the idea that COVID-19 is going to get them and it's going to kill them. This is the invisible viral boogeyman. The fact of the matter is, most people who are exposed to COVID-19 will not get it. We know that's true. Most of the people who get it will have mild cases. We know that's true. Those who have severe cases, most of them will recover. We know that's true. And of those who have really severe cases and are at risk for dying, even most of them will not die. Indeed, during the bubonic plague, during the Black Death of the Middle Ages, most people didn't die. And there was nothing. There was no sanitation. There were no flush toilets. There was no ample supply of fresh, wholesome food for poor people. Crowding, the squalor people lived in. Now, the Black Death was worse in the cities. And that's exactly what we have seen so far. You don't hear a lot about COVID epidemics out in the rural areas. You hear about it in the concentrated areas where people eat processed food, they're at close quarters, they're under a lot of stress, and they watch TV. The answer to this is to take a look at history and use a very broad view. Most people that got the Black Death did not die. Maybe a third did, a terrible number of deaths. But how come the other 2/3 didn't? And the answer is because of the immune system. The bacteria or virus, and there are those who think that actually the Black Death may have been viral. We don't know that, but whatever it is, it killed a lot of people. The answer is the immune system is the difference. The virus and the bacteria are the same. It's the immune system that differs.
Okay.
Right now,
let's go back to this immune system problem. You are the expert on vitamin C and other micronutrients, and you are very much familiar with the work of Dr. Klenner and Dr. Cathcart. Would you agree that the Chinese protocol with 24,000 milligrams in 7 hours IVC infusion is, in the view of Klenner and Cathcart, not enough? Shouldn't it be more than that?
In the view of Dr. Klenner, he would probably say that's pretty good.
Okay.
In the view of Dr. Cathcart, Bob Cathcart would say, that's idiotic. That's not nearly enough.
Right.
And the reason for this is Connor did something that a lot of people don't know about. Connor made house calls. Connor actually visited his patients, and he would give them intramuscular injections all through the day. And he was able to divide the dose and get very good results, partly because it was injection, partly because it was a divided dose, and partly because he was giving probably 24,000, sometimes much more than that. But Connor was flexible. If the patient was not doing well, he would have given more C. So 24,000 milligrams is a very good start. In many hospitals in the United States, they only gave 6,000. In some, they were only giving 3, partly because they were running out of vitamin C, partly because institutional review boards say, well, the tolerable upper level for vitamin C is 2,000 milligrams. Can't give more than that. Yes, you can. When someone's sick, they can hold much more. They need much more. They should be given much more. Dr. Cathcart would give up to 200,000 milligrams of vitamin C a day.
Or more.
Rarely more than 200, but you've got the right idea. He would give enough to get the patient better. Normally, Bob would give between 100 and 150 for a serious viral illness. Cathcart actually stopped calling illnesses by name. He simply called them by whatever amount of vitamin C it took to cure them. So to him, pneumonia was 150-gram cold. And influenza was 100-gram cold. And the common cold was a 60-gram cold. And everyone needs to remember that a gram is 1,000 milligrams. There's your lesson in metrics. So you're right, that Cathcart, for sure, Connor probably would use more. But we must emphasize something. Even 24,000 given intravenously will work very well, and it has, because Peng and Mao have reported that it did, and that's what they gave, and some people actually got less. Here's the kicker. If a physician or a hospital or a review board does not want to give megadoses of C, they don't have to. What most people die from with COVID is pneumonia or something like it. It's some kind of advanced respiratory SARS type of severe acute respiratory distress. It's some kind of lung issue. And this is where we have to go back once again to Cathcart and Connor, because what they have found in treating pneumonia is that vitamin C stops that bleeding, it stops the inflammation, it builds the immune system, and it increases oxygenation. What's even more interesting is that small amounts of vitamin C have been used. There was one study that used vitamin C orally for elderly patients with severe pneumonia in hospital. And when they gave them vitamin C, they had an 80% reduction in fatalities.
I believe you are a real white crow yourself. In one of your books, I've read that your white crow experience was with viral pneumonia. Could you tell the story?
Yes. Before I do, I just want to say one more thing that's striking. I just mentioned about elderly patients with severe pneumonia who were hospitalized and given vitamin C with an 80% reduction in fatalities. The amount they were given was 200 milligrams of C a day.
Right.
That is not even 3 times the RDA in the United States. 200 milligrams is something that will cost you a penny. You can buy it at any big box discount store. If you can triple the RDA and save the lives of 80% of elderly hospitalized severe pneumonia patients, we'd better do that. Incidentally, some countries or some regions of countries have done this. In Philippines, for instance, there was one region of Philippines where they were giving free vitamin C. And on YouTube, you'll find a video of a woman out in California who was going around in her car using social distancing and masks and gloves, and she was giving out vitamin C to the homeless. We have other examples where people have been using vitamin C very effectively. But the real key here is the dose to save lives can be very low. Now, in my case, I had double viral pneumonia. and that was diagnosed by an internist. There was no question. He, a friend of mine, gave me an antibiotic, and I said, why? This is viral. He said, well, that's for a secondary infection in case it comes up. And okay, fine. So I realized at that point that it was my immune system or nothing. So I was playing Scrabble with my wife, bless her heart, and coughing like crazy with a high fever, trying to distract myself and taking vitamin C. So I lined up vitamin C tablets, 2,000, 2,000, 2,000 in a little line, 1,000 twice, like little animals heading for the ark, and a big pitcher of water and a timer. And I took 2,000 milligrams of vitamin C every 6 minutes. In 3 hours, my cough stopped and my fever came down 3 degrees. Now that's 20,000 milligrams an hour for a total of 60,000 milligrams in 3 hours. But this is oral, and the absorption orally is not as good as intravenously. And that's why 24,000 intravenously can work very well. Basically, add a 0. Whatever you give intravenously, put a 0 on the end, because intravenous is probably approximately 10 times more effective than oral, according to Dr. Atsuo Yanagasawa, who is president of the Japanese College of Intravenous Therapy.
So if you would be in the position of getting this COVID-19 problem, and with your knowledge of Cathcart's philosophy of how high you should go, and if you would do it not orally but intravenously, and if you look at the Chinese protocol that they use 7 hours to do one infusion, is 7 hours enough or should it be more? And what would be your dose considering Cathcart? Would you take 150, or to be on the safe side, would you do 200,000 milligrams over 12 hours?
It's highly individualistic. The response of the patient should guide this. For decades now, I've been saying take enough C to be symptom-free, whatever the amount might be. This is true with IV as well as oral. With oral doses, your indicator of saturation is you get better or you have loose stool. Loose stool is Linus Pauling's own phrase. It's not diarrhea, it's loose stool. Nobody wants diarrhea. So you take enough C to feel better if you're using oral doses, but not so much as causes loose stool. And the best way to do that is to divide the dose all through the day. Now with intravenous, you don't have bowel tolerance indicator. With intravenous vitamin C, you don't have loose stool. With intravenous vitamin C, you also don't have to make the patient swallow a lot of tablets, because someone in ICU may not be able to even sit up. They don't feel well. That's why they're in intensive care. So intravenous vitamin C is tailor-made for someone who already has tubes running, who already has IVs in them. Just give them the vitamin C also. And when I say this, I'm not speaking as a physician because I'm not a physician. I'm telling you what the physicians that I work with and learn from have taught me. So whatever I know about orthomolecular medicine has come from the real masters. I stand on the shoulders of giants. It's a very humbling place to be. But the reason I speak with the force that I do is because these doctors knew what they were doing. And my father taught me when I was a boy, Andrew, if you want to know the real story, go to the organ grinder, not the monkey. It's very important to understand here that physicians are getting results and we need to copy them. So when someone is in intensive care, giving them the 24,000 in 7 hours IV might be enough to do the trick. If not, I would give them another 24,000 in the next 7 hours. And I would give them the vitamin C until they were able to sit up and say, I'm feeling a lot better. May I go home now? I would also like to add that you have to use common sense. There are some tests that need to be done. Most of the intravenous vitamin C clinics, such as the Reardon Clinic in Wichita, Kansas, arguably the top one in the world, or Dr. Yanagasawa's clinic in Tokyo, also among the very, very top, they would test for G6PD, they would check for other things, and you should. Now, there are some cautions, but even there, even with G6PD, which some people think means you can't have vitamin C, that isn't true. It means you probably should start with a much lower amount. And the Reardon Clinic has given 15,000 milligrams a day to G6PD patients by IV. So to start them at 150,000 without testing would be reckless. But hospitals always test. Doctors always test. That they do. What they have to add to this is, now that you finish that, now give them the vitamin C. So I've been saying again for a long time, make sure you take the reins and get the vitamin C in the veins. If you're waiting for the physicians in the hospital to offer this to you, you're going to have a very long wait.
I take the computer again to show your famous book, Vitamin C, The Real Story, together with Steve Hickey. In that book, there is a small passage where you discuss the problem Ebola, and sort of a hypothesis you are talking about 500,000 milligrams infusion. Since that book, has your opinion changed, or is it still that this might be a solution for Ebola, 500,000 milligrams infusion?
I stand by the idea that intravenous vitamin C for Ebola is a good idea. And I also stand by what I said earlier, which is it has to be adjusted for success based on patient response. I'm never going to walk away from that. I don't think any doctor should. The idea is to have a healthy patient. That's my double-blind, placebo-controlled study. I want them to walk out the front door. I don't want them on a gurney being wheeled out the basement door with a sheet over their head. This is the overriding concern. Get the results. And obviously, it's related to dose. So with medicine, we know that. Everyone who's ever studied pharmacology will tell you that dose has a lot to do with what you have for results. Dr. Hoffer commented on this once to me and said, why don't you write an editorial on giving 500 units of an antibiotic to a person who needs a few million units of an antibiotic, commenting on why 500 doesn't work and therefore the antibiotic is no good. And I did that, and Dr. Hoffer published it in the Journal of Orthomolecular Medicine, which I was also an editor of, an assistant editor. So with the dose here, you give the amount that gets the job done. You don't take the amount of vitamin C you think ought to work, you take the amount that does work. So by introducing and climbing with the dose, I would say climbing rapidly, but still climbing, you find the point where the patient responds and then the light goes off, or on in this case, and says, aha, we've done it. The doses in the Vitamin C Real Story book are also based on information we had a while ago and also reflect my co-author's viewpoints, Dr. Hickey, who is very knowledgeable about vitamin C, and I would defer to him. If Steve told me that it takes more, I would take more.
Remembering this book, you were talking about one guy in a hotel where 3 other guests were having the Ebola virus and they all died, and this one didn't die because he sort of knew something about the orthomolecular medicine. Is that the only case you know about Ebola having been survived simply by vitamin C?
That would be the end of my experience with Ebola, but I have a nifty one with COVID.
Okay.
Because Dr. Richard Cheng, who's in Shanghai, he's actually Chinese American, he's from North Carolina, but he was over in Shanghai visiting his parents and family for Chinese New Year in January of 2019, and everything hit, and of course he was confined to China at this point. Well, he made good use of his time, being a medical doctor, also a PhD. And he started working very energetically to get hospitals and doctors to use vitamin C for COVID. He's been very successful. He worked with Mao, he worked with Peng. He's been a very important person here, and we've been reporting on Dr. Richard Cheng's work in the Orthomolecular Medicine News Service, which, as you pointed out, is online and easily accessible. So here's a really nice one. Dr. Cheng interviewed a woman whose mother came down with COVID, and she was hospitalized for it, and the diagnosis was confirmed, and the mother did go to intensive care. She did recover. She did have vitamin C. She ultimately got better. But what's more interesting is that the mother lived with the rest of the family in one house in close quarters with several other people, I think 5 other people. All of them took vitamin C. None of them got COVID.
You're talking about this newsletter from March 5th, 2020? Vitamin
Yes,
C?
I am.
Okay, good.
And there it is in French, Italian, German, and English. This is an actual case report from a first-person interview, and the people that lived with the mother who had COVID did not get it, and they took approximately 20,000 milligrams of C orally every day. If everyone did that, if everyone did half of that, if everyone did even a quarter of that, I think the epidemic, the pandemic, would be caught dead in its tracks. And if I have nothing else that I ever get to say on COVID, it will be this. And vitamin C will slow it down. Vitamin C will stop the pandemic.
Would you agree with me that the Shanghai government official recommendation for vitamin C is the first time in the history of the vitamin C research history where an official body of a government acknowledges the effects of vitamin C in high doses? Is that the first time?
Pretty much. And by the way, we have evidence of this. Chang worked with the Shanghai government. He was the lobbyist, basically. He worked with the officials. And when we reported on this, Facebook, YouTube, and the media branded it fake news, false information, and refused to verify what it was we were reporting on.
So let's get this clear. Facebook and other corrupt institutions deny an official protocol as
Correct.
A factual lie.
Correct. What they said was the Shanghai government does not officially recommend it. Now, they weasel on this because it was a division of the government, their expert medical panel of some 25 experts, physicians, who published a protocol in the official journal of the Chinese Medical Association, the Chinese Journal of Infectious Diseases. And the Shanghai government has, in fact, endorsed that. Now, people have to remember the government is a little bit different in China. So you're going to have a slightly different way of using your words and describing what's going on. But Dr. Cheng has told me in no uncertain terms and gone public on this, that this is an official stance by the city of Shanghai.
In New York City or in New York State, I'm not sure, there was a company owning 10 or 20 hospitals, sort of duplicating the Shanghai Protocol in New York. Can you tell us about this?
Yes, we're talking about the Northwell chain of hospitals in New York City and Long Island. They're the largest healthcare provider in New York State. And New York State is one of the most heavily populated states in the United States. However, they only use 6,000 or less.
Oh, okay.
They gave, in some cases, considerably less, and they didn't necessarily give it to everyone. They went public with a statement a while ago, but we haven't heard much from them since. I think they're under pressure, but that doesn't change the fact that the New York Post, one of the largest newspapers in the United States, had a wonderful article on this, interviewing Dr. Andrew Weber, who's the pulmonologist with a big smile. I love his picture. And he was the one that was using vitamin C for COVID in New York. But I would tell you right now, being a resident of New York State, it's a big state, but I'm in the same state, that one of the reasons New York is so hard hit, I think it has the most COVID cases of anywhere in the United States. And one of the reasons it's so hard hit is because they're not using vitamin C. Our governor will not recommend vitamin C. The director of the National Institutes of Health Infectious Diseases Division will not recommend vitamin C. The World Health Organization on their website tells you it's no good. The CDC on their website will tell you it's no good. And yet, if you look carefully, there are actual CDC documents that suggest that vitamin C should be used.
And to add another corrupt politician, the president of the European Union, Ursula von der Leyen, is on that same line, saying that vitamin C is no good. One should probably shoot this person. But anyways, So we have a sort of picture about vitamin C in high doses in COVID. Now let's turn to vitamin D as in D. In my recent interview with Professor Hollis, we were talking about vitamin D in COVID. What's your opinion on, let's say, let's put aside the idiotic small doses. Let's say you have 80 nanograms per milliliter, which would be 200 and something nanomoles per liter. If you had a blood level of that type, would that be a good idea?
It depends. If someone is sick, the amount of vitamin D they're going to need to recover is going to be individual once again. When you have the tests done for vitamin D, which is easy to do, simple blood tests like you would for anything else, the thing to do is to question the interpretation. So if they say, well, it's 40, so it's normal.
Let's be clear. When we talk about measures, it's 40 nanograms.
That's my understanding.
Okay, nanograms per milliliter. Okay, from now on, it's nanograms. Okay.
I'm not the vitamin D expert. I refer my vitamin D questions to the people who do more with this, such as Michael Halleck and Bill Grant and others who are really very, very knowledgeable about vitamin D, as in Doug. But the point I want to make here is that by having a test, you can immediately see if you're normal or not. And then the next question is, if you're normal and sick, then you need more. But what we find is that most people that are tested are not normal. They don't have the normal amount. I'm an example. I've been taking vitamin D for decades. I've been taking 3 times the USRDA of vitamin D since I was in my early 20s. I increased that over time, and finally I decided I should get tested. Turns out I was low. I didn't see that coming. Yes. So I increased my vitamin D, and I was retested a while later, and I was still low. So now I'm taking 5,000 units of vitamin D every day, preventively. The International Society for Orthomolecular Medicine recommends that amount, scaling down to 2,000 after the first week or so. Whereas in Britain, they're recommending only a very tiny amount. And the United States, they're recommending only a tiny amount. So the dose is inadequate. We have to take more. And that's why we need to be sure that we question authority when they say all you need is 15 minutes of sun exposure a day or a tiny little amount of D. That's not true. We need more.
For our German listeners, if you Google Raimund von Helden with the term COVID, you find this video. And in this video, Raimund von Helden, the vitamin D expert in Germany, recommends more than 70 nanograms per milliliter to combat coronavirus. So in Germany, the discussion is a little bit more open than in the United States. Okay, let's go back in the history of the timeline of vitamin medicine. We discussed Jungblut, we discussed Klenner. Here we have Professor Ruth Flynn Harrell. Could you give us a story of Professor Harrell?
Yes, Dr. Ruth Flynn Harrell did her dissertation on thiamine. That's one of the B vitamins, the first one, vitamin B1, and its effect on IQ in children and learning. Dr. Harrell made this her life's work, and she found out not only was thiamine, vitamin B1, useful, but all the B vitamins were helpful, as was natural desiccated thyroid extract and some other nutrients. So she, in 1981, along with a number of very good co-authors, published a paper in the Proceedings of the National Academy of Sciences in the US, showing that very high doses of vitamins were effective for children with severe learning disabilities, including Down syndrome children. And she was showing an improvement in IQ, a dramatic improvement in IQ in Down syndrome kids. Well, this was published and it was immediately attacked. Why? Because she was using doses of B vitamins for children that were 100 times the USRDA or more. But as Dr. Harrell would point out, that's the amount that got them better. There's a wonderful quote about these children that when their IQ went up 10 points, the parents noticed it. And when their IQ went up 15 points, the teachers noticed it. And when their IQ went up 20 points, everyone noticed it. In fact, there's a photograph of Dr. Harold being hugged, my girl with Down syndrome, because she was so happy that now she could talk and she could read. You have children that are going to the point of being unable to be in a classroom, unable to do the work and to learn and to enjoy. And they are up to the point where they are able to behave almost like normal children. This is something that needs to be followed up on. And I think it's important to realize that with Down syndrome, we all know it's genetic. We're not trying to dismiss that. We're trying to point out that there's something else going on. Dr. Roger J. Williams, the discoverer of the B vitamin pantothenic acid, called this the genetotrophic concept. The closest phrase for that now that's popular would be epigenetics. In other words, given your genetics, is there something more you can do with nutrition? And the answer is yes. If you want to cross the Rhine River and a bridge is out, you may have to go up and down to find another bridge. Maybe 2 or 3 bridges are out. Maybe there's been a flood. But it's a big river, so keep going. Sooner or later, you'll find a bridge. Might take you longer, but you'll make it across the river. And this is what you can do with nutrition. And Dr. Harold's study showed that. I talked to a lot of people, many of them are very well educated, and none of them have ever heard of Dr. Harold's study.
Do you know of the time, it was 1942, about the effects this work had on the closest friends and neighbors and colleagues? Was there any reception in the closer area around Professor Harold?
Well, if you mean 1942, she was still in school. But if you mean 1982, right after her paper came out.
So we are not talking about Ruth Flynn Harold.
Oh, I see. You're referring to her very first work, yes.
Yeah, okay.
That was her dissertation, and then she followed that up with more on the same subject. I don't know how far it went specifically, but I do know this. During World War II, there was a tremendous interest in nutrition. And
yes.
vitamins became very popular because we had to have people that could be soldiers and also could be citizens. People were growing their own food. There were food shortages. Therefore, we had gardens. Because there wasn't enough wheat, we didn't want to mill it to white flour. We had whole wheat. People had less sugar. People had a diet that was rationed. People had limits on the junk food. There was no junk food. And this had a lot to do with it. And the 40s really was the decade of the vitamin. This is when they came into their own. And this is when we had the first standard, the minimum daily requirement in the US.
Okay, let's turn to the giant of orthomolecular medicine. Tell our viewers why Dr. Abram Hoffer is a giant in orthomolecular medicine.
Well, that would take a while. At my dryourself.com website, I have ample proof. I have a number of articles that Abram wrote that he gave me permission to put up. He was the founder and editor-in-chief of the Journal of Orthomolecular Medicine, now published for over half a century. And Dr. Hoffer certainly deserves my admiration because of everything he's taught me. The best way to learn about Abram, I think, is through his books, because that's what I did. And I would recommend you read everything he ever wrote. It was my privilege to have co-authored 4 books with Dr. Hoffer. One is Orthomolecular Medicine for Everyone. One is The Vitamin Cure for Alcoholism. One is Niacin, the Real Story, about vitamin B3. And the other is Hospitals and Health, which is about how you get vitamins administered in a hospital. Abram was a wonderful person with a great sense of humor. He was a real scholar. And I urge everyone to go to the organ grinder, him, and not the monkey, me, for your education, especially on using niacin for depression, anxiety, obsessive compulsive disorder, schizophrenia, psychosis, and ADHD.
There is a special story with Abram Hoffer and Bill W.
Oh, yes.
Could you still tell us that special story? The book about it is in one of your series. It's here, The Vitamin Cure for Alcoholism, Orthomolecular Treatment of Addictions. What's the story, Abram Hoffer and Bill W.?
The short answer is Bill W. was Abram's patient. Bill W. had solved his own alcohol problem and co-founded Alcoholics Anonymous to spread the word. But Bill W. had severe depression, and alcoholic depression is not uncommon, and it is no joke. Bill W. was seriously depressed for a long time. He was connected with Abram, and Abram had him take niacin. He had him take niacin 3,000 milligrams a day. The RDA for niacin is much smaller than that. It's around 13 or 14 milligrams a day. So 3,000 milligrams of niacin is a lot. Bill W. noticed immediate improvement. He was very impressed because he had had alcoholic depression for a long time and it was really bad. So Bill W. told his friends, and approximately 30 of his friends took niacin also. And a third of them had improvement very quickly, like he did. Another third had improvement in a longer time frame. And another third didn't think it helped very much. Well, that was all it took for Bill W., because now he knew that niacin was useful for a lot of people, and he wrote 3 monographs, 3 papers on this, urging the physicians of Alcoholics Anonymous to recommend niacin. Now, these papers were written quite a long time ago. You can read each one, the original, in its entirety, typed by Bill W. at dryourself.com. I've got them all posted there. And reading is believing. This is the founder of AA telling AA and its physicians to recommend niacin. It is now the year 2020, decades later, and AA does not and has not recommended niacin for alcoholics.
Okay, let's come to my next white crow example. I remember you talking in one of the lectures I like very much about the old lady sitting in the corner. Tell us the story how niacin got her out of the corner and how a doctor got her back into the corner.
Many years ago, when I was first starting out, I visited the home of a woman who was seriously depressed. The family had asked me to come by and talk to them about nutrition. The woman was basically unwilling to talk to anyone, and she literally just sat in the corner and was in her own world, and that's it. So she was under the treatment of a psychiatrist, and they tried various medications, but nothing was really working very well. And they wondered if nutrition could help. And I pointed out Dr. Hoffer's work. I mentioned to them that niacin in high doses would be worth trying because it seems to work. It worked for others. It worked in Dr. Hoffer's practice. And that she might need quite a lot because she was seriously depressed. And they should perhaps do the amount of niacin that got the job done and be prepared for it to be a lot. But to let the recovery guide the dose. And this is the point that I'll keep making. A patient that's better is the ultimate double-blind placebo-controlled study because it isn't either, and you don't need them. If you have a patient that's well, you're done. Now go and heal some more patients. So it was her turn, and the family was very enthusiastic, and they gradually gave her more niacin. Nothing really happened at first. It's to their credit that they kept going, and ultimately, they got up to a very high level. It was close to 11,000 milligrams of niacin a day. I think it was just over that. 11,500 stays in my mind. And at that level, she was out of the corner, sitting at the table and conversing with her family at mealtime. It was astonishing. So when they went to the doctor, to the psychiatrist, he said, well, that's very good, but that much niacin isn't safe to take. There are these possible side effects. You better not do it. So the family, being what Dr. Hoffer called pious patients, stopped her niacin. And the woman's symptoms came back, and that was the end of it.
So let's go back to the computer. The most important work of Dr. Hoffer is schizophrenia. Could you tell the story?
Well, there's so many. Abram tells them better than I do, but my most memorable experience was with a young man. I ripped this up for my website, dryourself.com, and it's also in the Dr. Yourself book, I think. I called him Jim. He was in his early 20s and he'd been discharged. Actually, he had been expelled from the New York State mental hospital system because he was too violent. So they sent him home to his parents. You got to question the logic of that. He only slept about an hour, maybe 2 hours a night, and he was really out of control. On a good day, his parents brought him in and we had a conversation. And I mentioned Dr. Hoffer's work with niacin and also supportive vitamin C, which Abram employed as well. So they said, how much? And I said, well, Dr. Hoffer would commonly give 3,000 milligrams. You might need less, you might need more. You can just introduce it and see how he does. And they said, well, it's worth a try. This kid was punching holes in the living room wall. I mean, it was a very serious issue. So they got him to take the niacin somehow. And when he got to 3,000 milligrams of niacin, he slept 18 hours that night. Now, this is a huge change and a huge improvement and a huge benefit for the family, not to mention for the fellow. And after that, he started sleeping about 7 hours every night. And within about 2 weeks, he came down in the morning and at breakfast time and said for the first time in a long time to his father, "Good morning, Dad." I mean, this brought tears to his father's eyes. It was very touching. Now, ultimately, the young man did not continue to take the niacin. And when I asked him that, he said, because I like the illness. Schizophrenics will often tell you that they enjoy that state and they won't take the medication, or in this case, niacin, because they prefer the other consciousness. In the same way, it's been said that alcoholics don't drink to get drunk. Alcoholics drink to avoid being sober. However, the young man said to me that when things got really bad, he would come home, take a bottle of niacin and a hot bath, and he'd feel better. So to some extent, Dr. Hoffer's knowledge had taken root. That isn't the right way to do it, but any port in a storm.
Okay, so there's another giant we have to talk about. That is Professor Dr. Multiple 47 Doctors, Professor Linus Pauling, a giant in chemistry and a giant in orthomolecular medicine. How did you come about Linus Pauling?
The way most of us did, through his books. When I was a student, I remember sitting down at the dining room table in Australia with a friend of mine. I was doing chemistry and he was physics, but we got along anyway. And we both heard about Linus Pauling. This is 1973. And on a paper serviette, we calculated how many oranges you would have to eat every day to get the kind of vitamin C dose that Pauling had mentioned. And it was hundreds of oranges, and we thought it was really quite funny. Well, 4 years later, I was married and had a son, baby son. And I didn't think it was so funny anymore because I wanted to keep my child healthy. And I then took the time to read Dr. Pauling's book, and I learned so much from him about, well, things that I've been talking about today. So Pauling's book that got everybody going was Vitamin C and the Common Cold, which he then revised, very importantly, to Vitamin C, the Common Cold, and the Flu. The other Pauling book that's important is How to Live Longer and Feel Better. This came out in the 80s, but it was revised and updated, I think, in 2006. So,
yes.
But this is a very good book still, and I recommend it.
So if you talk about Linus Pauling, do you know to tell something about his cooperation with Matthias Rath?
I know very little, except that they collaborated on at least 2 major papers for the Journal of Orthomolecular Medicine, showing that vitamin C and also the amino acid L-lysine were effective against atherosclerosis. I think they're very important papers.
Okay, now, next big person in the timeline of orthomolecular medicine is Dr. Robert Cathcart. He was working in orthopedic surgery, I believe. He was rather famous for his invention in that field. And then, do you know why he changed to become a physician with orthomolecular medicine?
Yes, I do. I have interviewed a colleague of Bob's, and he said essentially Cathcart was a physician on duty for either a short time or quite a long time, I don't recall the length of time, at a ski resort. And being an orthopedic expert, he saw a lot of people that had skiing injuries, and he seemed to come into vitamin C through that. So he simply found that vitamin C worked, and the more he gave, the better it did the job. And he found that it was useful not only for healing, which every nutrition textbook will tell you, that for wound healing and bone healing, any kind of healing, you need vitamin C, among other things, but you need C. He found it was very effective for people with viral illnesses, and it just fed itself because the better it worked, the more people came to him, the more he gave, and the better it worked. Cathcart never really published that much, but we have a complete listing of all of his papers at dryourself.com, and Bob very kindly gave me permission to post some of the most important. His paper on titrating vitamin C to bowel tolerance is a very important work, and I think should have gotten him a Nobel Prize.
Would
like
that be,
the others, he was not appreciated.
Would that be under C on your homepage, Cathcart?
That would be one way to do it, or you can scroll down to vitamin C. And go down to vitamin.
Vitamins.
Yeah, you have a ways to go yet. It's a big site.
It's a large homepage, okay. Vitamin
keep
C.
on, there you go. Up there you go. Vitamin C, and there's a whole series here. Titration, vitamin C titration by Robert Cathcart.
This one, yes.
For those who don't want to scroll, you can use the search engine at the website. That's quicker.
Okay. Okay.
This paper here is required reading for anyone who wants to know how high doses of C work. The Cathcart paper.
Yes. This one. Okay. Now let's go back to the timeline of orthomolecular medicine, and we are approaching Hugh Riordan. What's his story? And do you know, is there a case? I know that the Riordan Clinic does vitamin C adjunct with chemotherapy. Did they do the revolutionary thing to treat cancer only with vitamin C?
I would have to ask the medical director, Dr. Ron Hunninghake, about that. My understanding from my conversations with Ron and with Dr. Riordan himself, who I worked with the Journal of Orthomolecular Medicine, is that they used vitamin C with any person who had cancer, and almost every person fighting cancer was also on some form of conventional therapy.
Okay.
So it's expedient to say it's adjunctive.
So we are approaching one of the other scandals of the corrupt medical associations. Pauling did some research with a Scottish researcher, Cameron, I believe, and they did IVC, right?
Yes. Ewan Cameron was a surgeon at Vale of Leven Hospital in Scotland, and he and Pauling published their work in their book, Cancer and Vitamin C, in the late 1970s.
And then the scandal, the con job of the Mayo Clinic comes along. Could you tell the story?
The short answer is, when word of Pauling's and Cameron's vitamin C success got out, they were reporting a dramatic decrease in deaths among patients that were considered terminal. The Mayo Clinic said they would do a replication, and they didn't. They did a study that resembled the Pauling and Cameron study, but it was different in several different ways. what their criteria were, how they administered the vitamin C. And this is a long story, but the bottom line is it's not a replication unless it's a duplication. Every day, your cells divide and they duplicate the chromosomes as you repair your cells and as you grow. We count on your cells to replicate accurately. If they don't, you have a mutation, you have something wrong, and you have a dead or in some way limited organism. The same is true of science. If you don't do an accurate replication, it's not a replication at all. But the Mayo Clinic, of course, has a lot of cachet, and they had huge amount of press coverage on this, and that was the end of that. Same thing happened to Youngblood back in the 1930s when Sabin came along and did vitamin C work with polio, claiming it was replication, but he didn't use a high enough dose, not even close. And yet it's Sabin who is remembered, and curiously, a Sabin oral polio vaccine that took hold. So watch for that with COVID. There's going to be a vaccine, and there's going to be a vaccine really, really soon. I think they're going to lock you down until you agree to take it. I don't mean to sound too dark, but that is the short answer of what's going on here. Vitamin C is available now. How many people have to die while waiting for a vaccine? And that's assuming the vaccine will work. And if somebody has COVID, it's too late for a vaccine. We have to treat the people that are sick now. We have to prevent now. We have to save lives now. Vitamin C is available now. It's safe, it's effective, and it's cheap. And that would explain everything, wouldn't it?
And then we have the other story, another scandal, another con job of Dr. Fishbein of the AMA, the American Medical Association, in the 50s and after that. Tell us the story of the Gerson therapy in the United States. For our listeners in Europe, Dr. Max Gerson started out healing migraines with juicing and vegetables. And then he did a trial with the famous Professor Sauerbruch in Munich. But that's not the story we want to talk about today. Tell us the American story of Dr. Max Gerson.
Gerson fled the Nazi regime. Indeed, his entire family perished in the Holocaust. Gerson came to the United States and established practice on Long Island, New York. He had become a migraine doctor because he himself had migraines. And he found that if he used the organic diet and detoxified the body and took the juices, lots of vegetable juices, that it worked. So word got around and people started coming to him saying, well, not only did it get rid of my migraines, but it also did this and that and the other. Gerson became somewhat well-known because he was Dr. Albert Schweitzer's physician. And he cured Schweitzer's wife of diabetes. And apparently he also cured Dr. Schweitzer of depression. A friend of mine, Howard Strauss, the grandson of Gerson, actually tells of a car ride they had in Germany, hitching a ride with Albert Schweitzer is the name of it. It's an Orthomolecular Medicine News Service release that you can find. And Howard Strauss actually was there as a young man, and he tells about the encounter with Schweitzer. So Schweitzer and Gerson were very close. Dr. Schweitzer said of Max Gerson, and this is an exact quote, Max Gerson was a medical genius who walked amongst us, unquote. That's very high praise from Albert Schweitzer. So the Gerson therapy is still laughed at by most physicians. It's too bad, but this is what people do when they don't want to learn. And if you have prejudice like that, if you have already prejudged something, you have no business being in medicine. Scientific curiosity is very important for a scientist. It's essential for a doctor, because if you're not interested in how another doctor saved lives, you have no business being a physician.
If you go to our playlist, Dr. Andrew Saul, which you find on our channel, Kosmologie Mikronährstoffe, go to Andrew Saul, you find the second movie when Dr. Andrew Saul is doing something special with Max Gerson. Could you tell the story?
I was present to inaugurate Dr. Gerson, initiate, I guess is the word, into the Orthomolecular Medicine Hall of Fame. Now, this was after he died. He died in '59. But in the 2000s, the Orthomolecular Medicine Hall of Fame did induct Dr. Gerson, and Charlotte Gerson, his daughter, was there to receive the award. That was a very nice evening indeed. I remember Charlotte because she had on a bright red dress, and she glowed more than the dress did. This is what a good diet and juicing can do for you. Charlotte was a wonderful friend, and I'm glad I knew her because she was the window into her father's work. She worked very closely with Dr. Gerson and then carried it on for decades. The Gerson therapy, we need to keep this in mind, was developed by a medical doctor who wrote a book that was published back in the late 1940s, A Cancer Therapy, Results of 50 Cases. This is the book that got me interested in Gerson back in the 70s. A friend of mine handed me the book and said, you have to read this and you can keep it. And I did, and I have. A Cancer Therapy, the Result of 50 Cases, has images. It has actual x-rays before and after of 50 different patients that had cancer that was reversed on the Gerson therapy. It is a wonderful, wonderful document. So that's why Dr. Gerson finally got a medical honor. And Charlotte Gerson said that's the very first medical honor Dr. Gerson ever received.
The Gerson therapy has a lot to do with juicing. And you wrote a book, Vegetable Juicing for Everyone. Let's start with your book and then go along and sort of highlight the Gerson therapy about juicing. On our watch list, we have a playlist for juicing with the movies of Jason Vale and Joe Cross. First question, do you know the movie of Joe Cross?
Oh, yes.
What's your opinion?
He did a good job.
What's your opinion on the Fat, Sick and Nearly Dead movie of Joe Cross?
I think it's excellent. Our book, Vegetable Juicing for Everyone, is not a detailed book on juicing. It's not technical. It doesn't have many recipes. What it really is how I raised my children, getting them to juice when they didn't want to. And I co-wrote it with my daughter, so her side is in there as well. And now my grandchildren, of course, are juicing because my daughter had that happen. The movies on juicing are very good, and even the infomercials on juicing are accurate. I don't have any financial connection with anyone who makes or sells a juicer, but when they tell you that juicing is a good idea to be healthy and that you'll feel better if you do it, that's absolutely correct.
So if we go to the juicing, that's Heilsaften, Cross and Vale. Do you have any connection to Jason Vale? Did you see his movie?
Seen the movie, but I don't know him. I don't need to know him. We're on the same page.
Okay, so the Jason Vale story goes like this. There were 8 patients. He found them through an internet public announcement. They were very, very sick, and he did 90 days of just juicing. And then Fat, Sick and Nearly Dead is a 60-day juicing where Joe Cross healed his very, very bad urticaria. So the difference between Jason Vale and Joe Cross and Gerson is that in the Gerson therapy, where you treat the stage 4 cancer patients, you have a juice every hour, I believe, 13 times a day, a quarter of a liter. And then you have 5 enemas, coffee enemas, and you have supplements. And the problem for me is juicing like Joe Cross and Jason Vale, you can heal chronic diseases. What's your opinion? The Gerson therapy basically needs a clinical surrounding because nobody has the power to do for 24 months, 13 juices a day, 5 coffee enemas by himself. Whereas just juicing morning, midday, afternoon, evening, like Joe Cross and Jason Vale, you could probably do this by yourself. Isn't that a sort of problem for people wanting to do Gerson?
Yes. That's why people spend the money and go to a Gerson clinic, which is not inexpensive at all, but the work's all done from them. It is labor intensive. But Charlotte Garrison has said and written that you can do it at home, but you just need someone who will do it for you.
Right.
So you need a dedicated friend, neighbor, or family member to do it for you. A person that's sick with cancer should not be forced to do stuff or held accountable because they're too tired to do it. We have to come to their assistance. That's why we're here. That's what humanity is all about. We have to rise to that occasion, and we have to put our money where our mouth is. If you have someone in your family who has cancer, there isn't a question what you need to do. You need to get involved and learn everything you possibly can and do everything you possibly can. And most people stop with radiation, chemo, and surgery and the words of an oncologist. That is a big mistake. That's only half the story. If they don't talk about Dr. Gerson, if they don't talk about Dr. Reardon, if they don't talk about Dr. Pauling and vitamin C, or if they do talk about these people and disparage them, then you know you have the wrong physician. That's why my website's called Doctor Yourself. I don't really mean that you should never go to the doctor. I mean that you should take command. Oncologists should be open to anything that will help the patient feel better and live longer. The Gerson therapy and vitamin C therapy do that.
Do you know the story about the Australians doing a marathon for 365 days?
I do not.
Oh, okay. I don't find it right now. Okay, I tell the story myself. There was a breast cancer patient who healed herself with raw food, and then she did marathons, and they did a marathon every day for a whole year surrounding Australia. You can find this on our channel. Now let's come to you personally. Tell the story about your children not getting any antibiotics.
All right, it's an easy one. We used vitamin C instead. When my daughter was only 4, she had a terrible cough. Now, up until this time, my son, who was 2 years older, and she had always had extra vitamin C and a good natural diet, whole foods, the whole thing, garden vegetables, and good lifestyle, I would like to think. And they took quite a lot of C. But she became very, very ill. She had a really terrible cough. It was one of those coughs that just would not quit. And finally, I decided to pay attention to what I had read about Dr. Robert Cathcart, who said, take enough vitamin C to get to bowel tolerance. Now, I knew that, but I hadn't done it. And I hadn't done it because the situation hadn't yet forced me to. If there's one thing about COVID-19 that could be good, it's that it's forcing people to realize that their lifestyle is destroying their immune system and leaving them vulnerable to this or any virus. That is an important lesson. But it would be much better to not have to learn that by having someone get really, really, really sick, and especially to die. So given the stimulation that I had a really sick little girl here, I thought, well, I guess I better take her to the pediatrician. And I thought, but before I do, I'm going to try Dr. Cathcart. I thought, he seems reliable. It looks to me like he knows what he's doing. And I decided to give her high doses of vitamin C. Now, she was 4 years old, and she had, in divided doses, 4,000 milligrams of vitamin C an hour. And in a few hours, 2 things had happened. One was she was sitting on the toilet, and the other was her cough had stopped. So we did exactly what Cathcart said, and it worked exactly as he reported. We gave her enough vitamin C to get her to loose stool, and that stopped the cough, and the improvement was dramatic. Years later, my granddaughter, that is my daughter's little girl, had a severe vaccination reaction. Same thing. She gave her very, very high doses of vitamin C, and she reversed the vaccination reaction in less than an hour. Now, this was a severe reaction where the child was actually screaming, falling down, losing coordination, and when checked with an experienced pediatrician, she actually had brain inflammation. She actually had encephalitis. Very high doses of vitamin C stopped that in less than an hour, but she took an enormous amount. So vitamin C is very, very powerful as an antiviral. Cathcart emphasizes you take enough C to get to bowel tolerance. This is for oral doses, and dividing the doses works better. For people that have trouble with the acidity of vitamin C, you can use sodium ascorbate. Or you can simply take vitamin C and put a little bit of baking soda in there, that's sodium bicarbonate, and that will neutralize the acidity.
Okay, you are one of the starring guests and one of the producers or executive producers of this movie. How did this come about?
Well, I have an ego the size of Texas. That may have something to do with it. But I think the real reason is we wanted to bring orthomolecular medicine to the people, to take it out of the journals and put it on the big screen. Previous to this, I had been in the movie Food Matters, and that reached so many people that it occurred to us that Food Matters talked about vitamins and also food. We would do one just on vitamins and get a little more focused. So that brought along that vitamin movie. And in that vitamin movie, we interviewed a large number of orthomolecular doctors. These are physicians who actually use high-dose nutrition to cure patients. So there's a wonderful collection of experts in that vitamin movie. I'm honored to be in it.
Do you know the address? Is that the address of that? Yes, there it is. And yeah, there you can watch the first 30 minutes for free, right?
You can. And once in a while, they have a week of free screening. I don't know when the producers are going to do that again, but if you go to my Facebook page, where I'm the Mega Vitamin Man, that announcement would go up there.
So let's go to your Facebook page. Originally, you called yourself the Mega Vitamin Man, right?
Yes, and I still am at Facebook.
Okay, and this would be the Facebook page where the information would come out that the vitamin movie is for free for a week or so, right?
Right, and I have no idea when that will be. In the meantime,
Right.
I'd urge people to watch the first 30 minutes because you'll get a good sense of whether or not you'll ever want to watch the final 60 minutes.
Going back to your family life, you not only use vitamin C for your children. When the people see the movie, that vitamin movie, there is a sequence. I believe you had to do this twice. Is that right? Tell the story what happened.
Well, I was demonstrating that I take a lot of vitamin C, and I had a container
not only vitamin C. There was vitamin C, there was this and that and that and that and that and that and that and that. That's what you take every day, right?
It is. I was asked by the director, Michael Beattie, who's an experienced BBC director and also worked for Irish television. He's won awards. Michael's a wonderful director. And he said, well, let's show what you take every day. So I did and talk about it. And that was okay as it came out. But the part that was the second take that's unusual is that I was taking vitamin C specifically, and I took 17,000 milligrams of C at once.
Yes.
Well, the take didn't work, so I had to do it again. Now, don't try this at home.
This was a toilet nearby?
Well, it didn't have to be because I was under a lot of stress at the time with the filming. Okay. And my stress was off the wall. Now, any normal person could not take 34,000 milligrams of C at once without having loose stool or worse. So don't do that. But in my particular case, it didn't even cause a ripple because I was under so much stress at the time. The same is true during the COVID issue. Back in the early part of 2020, there's a video that was made of me by a Korean doctor, and I looked terrible because I'd been working day and night, communicating with people in China and other parts of the world as well as the United States. And they were getting up when I would be normally going to bed, so it was a tremendous strain. My vitamin C consumption at that time was through the roof. Remember, it's not a contest. When you're sick, you need an astronomically larger amount of C than when you're healthy. I know people that get by just fine on 500 milligrams a day, 1500 milligrams a day. I know a number of people who only take that much and they're fine, and that's all you need to know.
How about your family?
When you're sick, you need enough to get well, and it's an order of magnitude or even 2 orders of magnitude more when you're sick.
So about your family, everybody has an orthomolecular individuality, according to Professor Williams, I believe. Now you take 18,000 milligrams if you're healthy, right?
Yes, and I'm going to mention that I've been doing a lot more vegetable juicing, and I'm now taking less C.
Less C.
Vegetable juices are excellent antioxidant sources, and vitamin C is an antioxidant. So this changes. Okay. It isn't a hard and fast rule. You do what keeps you well. My wife says to me that I look a whole lot better than I did a few months ago, and she thinks the juicing has had a lot to do with it, and I'm here to tell you that she's probably right. Compare this video made in the end of June 2020 with the ones I made in March and April 2020, and you're going to see this old wrinkly son of a gun staring back at you.
Yes. So
and now I'm the picture of health.
So what did you do today? How many grams of vitamin C today?
Today I've had very little C. I'm now doing 1.5 quarts of kale carrot juice every other day.
And how much vitamin C in grams?
Normally I would probably be taking around 6,000 to 8,000 milligrams of C a day.
Same with me. Okay, now let's go to your personal protocol. Vitamin C, how much vitamin D do you take?
Vitamin D, I think I mentioned earlier, I hope I did, I take 5,000 units a day, but that's because I tested low on anything less.
And I take 20,000 a day, and I have 88 nanograms at the moment. Okay, how about zinc?
The International Society for Orthomolecular Medicine recommends zinc every day, 20 milligrams to prevent COVID.
Okay.
The RDA is not a whole lot less than that for men, and I personally take approximately 50 to 65 milligrams of zinc a day. But this is because I'm male. And I think there's a lot of reason for men to take more zinc because I think it's effective in reducing your chance of having enlarged prostate and prostate cancer. In fact, I think zinc will actually help you reduce a swollen prostate. And I am taking that because I'm a guy too, and I have the gray hair to match. So men need more zinc than women. Women need a little. Men need zinc like women need iron. Women lose iron in menstrual flow. Men lose zinc in seminal emissions. So these are the minerals that we often don't think about. And when you go to the store, you'll see a lot of iron fortified foods, but I haven't seen any foods now fortified with zinc. You don't usually see that, do you?
How about magnesium?
Magnesium is very important if you're trying to avoid hypertension. And during my COVID stressed out 12 weeks of nonstop work, my blood pressure shot up. So I got serious, not only with juicing, but also with magnesium. And I'm now taking much more than I used to. I used to take about twice the RDA. I'm now taking 4 times the RDA of magnesium.
How much is that? How much is that?
The RDA is about 350 milligrams a day.
Okay.
So I was taking 600 or 700, maybe a little less. And now I'm taking probably 1,200 or more. And that's including vegetable juicing, which is a magnesium source as well, and eating nuts and whole grains, which are magnesium source. So I'm taking a whole lot of magnesium, and I am not having the laxative effect. Because if you take too much magnesium, you will have a laxative effect.
Okay.
And I know it's the magnesium because with all the juicing, my C level has gone down, as I said before. So I'm now taking a lot of magnesium, and people ask what form. Magnesium oxide is the worst form. It's badly absorbed. Magnesium citrate is well absorbed and cheap. Magnesium malate is very well absorbed, and magnesium chelate is well absorbed. Magnesium chloride is well absorbed, and there are some other forms you can take as well. So with magnesium, all you have to do is not take magnesium oxide because it's a waste of money.
Okay.
It won't hurt you, it just doesn't work.
Do you take vitamin K2, MK7?
I have kale,
Okay.
and I grow so much kale
Okay.
that I don't need to go near a vitamin K supplement. I have a yard full of it.
Just a second. We are talking about vitamin K2, which is not in kale, okay?
Right, but we're talking about vitamin K1, which is
in kale, right?
And the body will, with a healthy gut biome, will convert K1 into K2 by way of K3.
So that's your philosophy, that the body transforms enough of K1 into K2?
Well, it depends. As Dr. John Canall, MD, points out, it depends if you have enough K1. He said the biggest problem we have is we don't eat enough greens.
Yes, right.
So we're looking at a skewed representation. We're looking at a population that needs K2. That's because they don't eat kale and cabbage. And it's because so many of us have had antibiotics.
Okay.
So many of us are heavy meat eaters. So many of us have constipation. This will alter your colon situation. So we know it's true in rats, and we know it's true in people, that if you have enough K1, and if you have a good probiotic-rich intestinal flora, you will make K2.
Okay.
So that's my point. Now, if you're not going to eat right, you better take K2, but it's expensive.
For the Europeans, the soil is deficient of selenium. Any recommendation about selenium?
Yes, the International Society for Orthomolecular Medicine, of which I'm a member, also recommends selenium 200 micrograms a day. Even 100 would be good, and Dr. Hoffer used maybe 800 and found no problem with it over his decades of practice.
Okay.
200 micrograms of selenium is not very much selenium at all.
Yes.
And in most of the United States, selenium deficiency in the soils is the rule, not the exception.
And the last supplement I want to ask is, America is famous for Dr. Brownstein and the topic of iodine. Is that a topic for you?
I'm not an expert, but I think that substantially he's correct that we need more iodine.
Okay.
I do not agree with him in terms of the extremely high doses of iodine that he recommends.
Which I take every day, 12,500 micrograms. That's my dose.
Now you're saying micrograms.
Micrograms, yes.
Okay,
12.5 milligrams.
12.5 milligrams is a very large amount of iodine.
Yes, I know. I don't recommend it to anybody. Don't do it on your own. Read enough literature to decide. Don't do it just for fun. If you want to do it, you have to be knowledgeable.
That is true across the board with all vitamins and minerals, and iodine for sure. I have a very simple solution with iodine. I just paint tincture of iodine on my skin once a week, and I let my body decide how much it wants.
Yes, yes. Which is recommended to check. It's a sort of test.
Right. So I agree with him basically, but I do not think that we need to go into the 20 milligram range, and I personally don't even think we need to go into the 10 to 20 milligram range. Okay. I would concede we need milligrams, not micrograms.
Yes. So we leave the very large field of orthomolecular medicine with supplementation and open an even larger field. What is your personal opinion on nutrition? I believe you are following a plant-based whole food lifestyle. Is that correct?
That's substantially true. Whenever you use the word plant-based, you have to understand that there's a common misunderstanding with it. People that say they have a plant-based diet or a whole food plant-based diet are usually vegan. And that means they have no animal products whatsoever, no dairy, no eggs, certainly no fish. And I call that vegan.
Yes.
Vegan is vegan. Vegan means no animal products at all. And I think that's a very good diet for most adults to have for 6 months to a year. I do not think it's a good diet for growing children. I do not think it's a good diet for the elderly. I do not think it's a good diet for pregnant women. I raised my children ovo-lacto-vegetarian. That means they had dairy products and eggs, which are protein high. And they also had, the rest was vegetable. So we were what I would call near vegetarian, but I've tried that phrase and nobody likes it. So I now say plant-based, but then I qualify it. To me, plant-based means based on plants. It does not mean entirely plants. If you send your children to a parochial school, they will get a faith-based education. It does not mean they won't learn math. It does not mean they won't learn English. So plant-based means based on plants. 51% of the diet or more should be vegetables, as fresh and organic as you can do. I personally think that meat eating is to be minimized, and I personally think that the keto diet is not a good long-term solution to health for most people. I think the best approach is plant-based with supplements. And there's the second way I depart from the plant-based people. Not only do I eschew the vegan part of it, but I also don't agree with avoiding supplements. So when I say I'm plant-based with supplements, that means I'm not vegan and I allow supplements. To put it in Susan Humphrey's phrase, there's no amount of foods that are going to cure viral pneumonia.
Right. And how much B12 for vegans, at least?
Funny thing is, the only people I've ever met who tested high for B12 have been vegans.
Oh, okay.
Classically, in nutrition textbooks, they tell you that vegans are at risk for too little B12. But the thing is that vegans tend to have wonderful intestinal flora, so they have more bacteria that make B12. Consider this. What's a good source of B12? The answer is meat. Well, I'm a former dairyman, and I used to milk 120 cows twice a day. Now, cows are very, very large, and when they broke a leg, they would often be slaughtered, and there'd be meat for weeks and weeks and weeks. And this meat is high in B12, and yet the cows never ate anything but plants. And they synthesized it because they have a wonderful digestive flora. This is, to some extent, transferable to human beings. For people that are having a normal diet, they're going to get their B12 in meat. But I would recommend that people, as they age, consider taking more B12 because the elderly don't absorb it as well. You don't make intrinsic factor anymore, so the B12 absorption goes down. The elderly also are less likely to eat proper meals anyway, and the elderly are at risk for Alzheimer's disease. Clinically, the symptoms of Alzheimer's and B12 deficiency are almost identical. So I think it's something that should be looked into, and by golly, it has been. When we study animals with Alzheimer's disease, we find that when we give them B vitamins, we can reverse it. There was one study with niacin, specifically niacinamide. The researchers took mice with Alzheimer's disease, they gave them niacinamide, and they said cognitively they were cured. It's as if they never had the disease, and that's an exact quote. And they added, and the cure cost $30 a year.
So you mean if you're going by niacin or niacinamide, you don't need ginkgo biloba?
I have no objection to ginkgo biloba. Do both if you can afford it. Okay. But if you had to make a cost efficiency decision, I would go with the research that used cheap niacin.
Okay.
Niacinamide, which does not cause a flush.
Yes, yes.
I'm nearing the end of my attention span. This has been a long interview.
The same with me. I want to thank you very, very much for your long patience for this long interview. And it was a very great possibility for the German channel to have you on our channel. And I will end the recording. We talk a little bit later after the ending of the recording. For now, thank you very much to Dr. Saul und herzlichen Dank fürs Vorbeischauen und auf bald.